Hello, my name is Robin Bourgeois. I'm the assistant to the graduate dean, and I also manage our graduate student health insurance plan. We have a new health insurance provider this year. The state IHL board opted to select a statewide plan for all colleges and universities to use. It's provided by Wellfleet Health, and it uses the Cigna PPO. I will give you some highlights as well as information about enrollment and premium payment. The first question that people always ask when we tell them about the student health insurance is how much does it cost? So that is the first information that I always provide. If you'll look at the chart, you'll see there are several different rows. The first row would be for an unsubsidized participant. That would be either an international student or a voluntary enrollment. We'll get a little bit more into that in a moment. The next two rows are for graduate assistants. The second row shows for a quarter-time assistant. The third row for a half-time assistant. For students who are on graduate assistantships, we do subsidize the premiums. Quarter-time students are subsidized at 35% by the university, and half-time graduate assistants are subsidized at 70%. And you can see the rates there on an annual and semester basis. If you'll note, the spring premiums are slightly higher than the fall premiums. You're paying for a larger enrollment period in the spring. The spring also includes summer coverage, whether you're on an assistantship or enrolled in classes or not. The last three rows are for dependent enrollments. You'll see there's a rate for a spouse, a rate for a first child, and a rate for more than one child. So if you have two or more children, you pay that $4,008 rate. If you do enroll a spouse and one or more children, you would take the sum of those two rows would be the cost of the premiums. For those voluntary enrollments or for dependent enrollments, you do pay the premiums directly to Wellfleet. For unsubsidized international students who are enrolled in the plan, your premiums will be charged to your bursar account. That will happen after the 10th day of classes, and you can pay those premiums to the bursar's office through My Ole Miss. For students who are on assistantships, your premiums will be deducted through payroll deduction. We take that from 6 pay periods each semester. In the fall, we begin with the September 15th payroll, and it would come out of the September, October, and November pay periods. In the spring, we begin with the February 15th payroll, and that will come from the February, March, and April pay periods. If you enroll a spouse or dependent, or if you're a student enrolling on a voluntary basis, you would pay that directly to a Wellfleet student using their website. This slide will show you just an overview of the benefits. There is a highlights brochure as well as the full plan available for download at the graduate school website and also on Wellfleet's website, which is linked from the graduate school website. There is a $500 annual deductible for individual enrollments. If you have dependents, you will have a $1,000 combined family annual deductible. The maximum out-of-pocket costs are also based on individual versus family. It's a $7,000 out-of-pocket maximum for individuals, and for families, it's a combined $14,000 out-of-pocket maximum. The pharmacy benefits are structured in a tier structure. For more information on what drugs are listed in what tier, you can look at the formulary, which is available on Wellfleet's website. There's a link there, and again, also on our website. There are some generic drugs that have a $0 copay as well. For emergency room visits, there is a $150 copay and then 80% covered if you're in network. For physicians and urgent care visits, it's a $20 copay, and then there is 80% coverage after the $20 copay. There is no requirement this year to visit a student health center first before going to another provider. However, if you do go to the student health center first, they do waive the deductible and the copay for all covered medical expenses, so you will save some money by visiting the student health center if you are able to. This plan includes a vision discount program. Details on that program are available at Wellfleet's website. You can find out how that works and who the providers involved are. There is an optional add-in dental discount program. It is done through Carrington Dental. It is not done directly through Wellfleet. They contract out for that. That is optional. If you choose to enroll in it, you will have to go to the website that's linked from Wellfleet and enroll yourself. It's $5.95 per month or $53.55 per year. There is a $20 non-refundable processing fee. And it's important to note that the premiums for that are in addition to the premiums that were discussed earlier. They're not taken from payroll deduction, and you will need to pay those directly to Carrington Dental. Treatment for in-network doctors is covered at a higher percentage. Generally, it's 80 versus 60% after your deductible and copay. So I do recommend that you find out if your provider is included in the Cigna PPO network, which is the network that Wellfleet uses. You can visit that website to find a list of participating providers, and again, it's linked from the graduate school website as well. If you already have health insurance and you want to keep that insurance, you may do so. The graduate school does require that graduate assistants have some insurance, but it does not have to be our plan. If you have other insurance, you can request the waiver participation. You will do that through Wellfleet's website. The waiver deadline for fall will be September 18th, and for spring, it will be February 19th. You can visit the Wellfleet website, select the University of Mississippi, and then click Enroll or Waive, and select Waive Graduate Assistant Students. Please note that you will not have access to request a waiver until we have sent your information to Wellfleet, and that will happen when your assistantship e-form is finalized by Human Resources. So as that happens, you will be given access to the site. I send files on a weekly basis, and you'll get an email from me when you have access. If you have not gotten an email from me, then you do not yet have access to the website. If you're an international student, whether you're on an assistantship or not, if you have other health insurance and you would like to waive participation, you'll need to contact the Office of International Programs for that. You cannot do those waivers through Wellfleet's website. Just a few miscellaneous issues. If you are a domestic graduate student who is not on an assistantship, we do now have the option for you to enroll on a voluntary basis. You can do that directly through Wellfleet's website. There's a link to that there, and there's also additional information on the voluntary enrollments at the Student Health Center website, and the link for that is also shown here. Make sure that your billing address with the university is listed correctly. That is the address that we will send to the insurance provider. So should they need to send you any paperwork, that's the address that they would use. If you need to update or check your billing address, you can do that through My Ole Miss. Insurance cards will not be sent out through the mail. You'll need to print that from their website. That will be available after the August 15th start date. If your enrollment has not been processed yet at that time, you should have it within a day or two of your enrollment being processed. If you have any disputes with claim settlements or other problems with using your insurance coverage, please contact me. I will be happy to contact our account representative and see what we can do to help resolve those problems. And on a final note, with COVID and our current situation, Wellfleet Student is covering all costs related to medically necessary testing for COVID-19. And what they mean by that is you are either symptomatic or you meet some other CDC or state guideline to receive a test. They do not cover asymptomatic testing. And if you are unfortunate enough to test positive for COVID-19, they do waive the copays and deductibles for the treatment, so you will not have to pay anything out of pocket for treatment for COVID-19. As always, if you have any questions, problems, concerns, feedback with the health insurance plan, feel free to contact me. Again, my name is Robin Bourgeois. My contact information is available on the graduate school website. Let me know if you have any questions, and thank you.